لباش يدوم دا fibular stertus is a separated part of EDTL money interdigital longus which share its synovial sheath. Proximally, the attachment and fleshy part of the digital and FT are continuously. However, distally, the FT fibular stertus tendon is separated and attaches to the 5 metatarsal bone, not to the phalanxes. Fibular stertus is not always present in all people. Originates distal 1/3 anterior fibula in interosseous membrane. Insertion dorsum shafted of the 5 metatarsal. Innervation deep fibulara. Action 4-foot eversion, weak ankle dorsoflexion. Lateral compartment of the leg. The lateral compartment of the leg or evaluator compartment is the smallest, which means narrowest, of the leg compartment. It is bounded by the lateral surface of the fibula, the anterior and posterior intermuscular septa, and deep fascia of the leg. The lateral compartment is the inferior leg at the posterior fibular reticulum, which span between the distal tip of the fibula and the calcaneus. Here, the tendon of the two muscles of the lateral compartment, fibularis longus and brevis, enter a common synovial sheath to accommodate their passage between the superior fibular reticulum and the lateral malleolus, using the latter as trochlear as they cross the ankle joint. Muscle in the lateral compartment of the leg. The lateral compartment containing two muscles, fibularis longus, brevis muscle. These muscles have their fleshly being in the lateral compartment, but are tendency as they exist the compartment within the common synovial sheath deep into the superior fibular reticulum. Both muscles are evaluated of the foot, elevating the lateral margin of the foot. Fibularis longus is the longer and more superficial of two fibularis muscles, arising much more superiorly on the shaft of the fibula. The narrow fibularis longus extending from the head of the fibula to the sole of the foot. Originates head upper 2/3 lateral surface of the fibula. Its tendon courses behind the lateral malleolus underneath the fibular trochlear, and lies in the groove in the cuboid bone before going to its place of insertion. Insertion inferior lateral surface of the medial cuneiform, first metatarsal on its inferior surface. Nervacetia superficial fibula. Actinocatia foot rot evasion, ankle plantar flexion. Fibular brevis. It is uniform, it is fusiform muscle that lies deep to the fibular brevis. And true to its name, the FV is shorter than its partner in the lateral compartment. It is broad tendon groove to the posterior aspect of the lateral malleolus and can be palpated inferior to it. Originates lower 2/3 lateral fibular courses behind lateral malleolus and underneath the fibular trochlear. Insertion tuberous on the base of the 5 metatarsal. Nervacetia superficial fibula. Actionacetia foot rot inversina. Ankle plantar flexion. Posterior compartment of leg. The posterior compartment of the leg, plantar flexor compartment, it is the largest of 3 leg compartments. The posterior compartment and the muscle within it is divided into superficial and deep subcompartment. The muscle groups by transverse intermuscular septa. The tibial nerve and posterior tibial and fibular vessel supply both parts of the superior compartment but run in the deep subcompartment deep anteriorly to the transverse intermuscular septum. The larger superficial subcompartment is the least confined compartment area. The smaller deep subcompartment, like the anterior compartment, is bounded by 2 leg bounded and the interosseous membrane. that bind them together, plus the transverse intermuscular septum. Superficial muscle groups in the posterior compartment. The superficial group of the calf muscle forming the prominence of the calf of the posterior leg, including gastrocnemius, soleus, and plantars. The gastrocnemius and soleus sharing a common tendon, the calcaneus tendon, which attached to the calcaneus. Collectively, these two muscles make up the three-headed triceps. The gastrocnemius is the most superficial muscle in the posterior compartment and forms the proximal most prominent part of the calf. At the knee, the facing margin of the two heads of the gastrocnemius form the lateral and medial border of the lower ends of the popliteal fossa. In the upper legs, the head of the gastrocnemius combine to form a single elongated muscle belly, which forms much of the soft tissue block identified as the calf. In the lower leg, the muscle fiber of the gastrocnemius converge with those of the deeper soleus muscle to form the calcaneus tendon, which attaches to the calcaneus of the foot. Gastrocnemius originated in the medial lateral manhea. Medial head from the posterior non-articular surface of the medial femoral condyle. Lateral acacia from the lateral surface of the femoral lateral condyle. Insertion acacia inserting into the middle 1/3 of the posterior calcaneus surface. Action acacia, powerful plantar flexor of the ankle. Innervation acacia, tibial nerve. Plantaris. The plantaris is the small muscle with a short belly and a long tendon. This vestigial muscle is absent in 5 to 10% of the pupil and is highly variable in size and form when present most commonly as a tapering slip about the size of the small finger. Origin acacia, inferior aspect of the lateral subcondylar line of the distal femur. Insertion acacia, middle 1/3 of the posterior calcaneus surface, just medial to the challenge tendon. Action acacia, plantar flexor of the ankle, also flexes knee joint. Inversion acacia, tibial nerve.